Hi everyone, so today we are going to present about the contraception. My name is Isam Rashida Binti Din Malik. My matric number 070774. And my name is Fatin Adaba Sayakira Binti Faisal Azam. My matric number 071029.
Contraception is defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. Thus, any device or act whose purpose is to prevent a woman from becoming pregnant can be considered as a contraception.
There are many benefits of using contraception, which they can have safer sex, prevent unplanned pregnancy, such taking oral contraception pill. Next is to prevent sexually transmitted infections by using the condom. Then contraception is good to reduce bleeding with heavy menstrual cycles, reduced cramping, reduced pelvic pain, manage bad hormonal acne and abnormal hair growth. It is also as a treatment for premenstrual syndrome, PMS, such as bloating, headaches and moodiness. Furthermore, it is a treatment for premenstrual dysphoric disorder, PMDD. Last but not least is to decrease the risk of deficiency anemia. Who can use it? People who have or have not had children, are married or not married. Third is to women who don't have desire to pregnant. For any age like adolescent and women over 40 years old. Women after childbirth or during breastfeeding or just had miscarriage and ectopic pregnancy. Anemia and HIV. Types of contraceptive include implants, intrauterine devices, injection, oral contraceptive pill, vaginal ring, male condom, female condom and diaphragm. Next is tubal ligation, vasectomy and natural method. First is implant. Implant is a small flexible plastic rod that's placed under the skin and upper arm by a doctor or nurse. It's 99% effective. Second is IUD, and it is 100% effective. Third is injection. It can releases the hormone progesterone into the bloodstream to prevent pregnancy. Next is taking oral contraceptive pill. These both contraception is 99% effective. Vaginal ring is a type hormonal contraception and is a good option for those who find hard to take pill every day. It is 99% effective. Diaphragm or a cap fits inside the vagina and prevents sperm through the cervix, and it is 88% to 94% effective.
So think about the ring similar to placing a tampon, but you actually do have to place it a bit higher. If you bend it and you get into a good position, either squatting or laying down flat on your bed, then you can actually get it to the right place where it's supposed to be, and it'll open up at the top and sit there until you're ready to take it out. And it can stay there for 3 weeks. It will not interfere with sex or anything like that. And then you actually take the ring out during the 4th week to have a period. And you do this every single month. All you have to do is simply take it out. You can reach in and grab the device, and then the hormone is out of your body. If you have something like the Nuva ring, you'll use a different ring the very next month. There was also a new form of the ring that's called aloe vera, and this one is actually reusable. So you can still do it the same way, where you place it every 3 weeks and allow yourself to have a period the 4th week, but you can actually use the same device, and that may save some money over time.
Male condom is more effective, which is 98% than the female condom 95%. It is because male condom more easier to place on the erect penis and stop the sperm from entering the vagina. Tubal ligation. The fallopian tubes are cut to block the sperm and egg from meeting, while the vasectomy is cutting the vas deferens to prevent sperm transport. This too is 100% effective method. Natural planning using the cervical mucus method by looking the changes in mucus help to know when to ovulate and are able to get pregnant. It is 75% to 88% effective. Furthermore, the calendar method can tracking menstrual cycle to predict ovulation, and it's 77% to 88% effective.
Once the implant is in place, you don't have to think about it again for 3 years. It's very useful for women who find it difficult to remember to take a pill at the same time every day. The implant can be taken out if you have side effects. The birth control implant isn't known to have many side effects. Most side effects subside within a few months. Some of the potential side effects are spotting or changes in normal menstrual bleeding, headaches, acne, sore breasts and mood swings. IUD are divided into 2 types, which is hormonal IUD and copper IUD. The hormonal IUD has several types, which are Mirena, Kyleena, Liletta, and Skyla. These IUDs use the hormone progestin to prevent pregnancy. Progestin is very similar to the hormone progesterone that our bodies make naturally. Mirena works for up to 8 years. Kyleena works for up to 5 years. Liletta works for up to 8 years. And Skyla works for up to 3 years. While the copper IUD, or also known as Paragard, IUD doesn't have hormones. It's wrapped in a tiny bit of copper, and it protects you from pregnancy for up to 12 years. Hormonal IUD side effects can include pain when the IUD is put in, and cramping or backaches for a few days after, spotting between periods, irregular periods. While Paragard's side effects can include spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods, pain when your IUD is put in, and cramping or backaches for a few days after. The duration for contraception injection is it lasts for 8 or 13 weeks depending on which injection you have, so you do not have to think about contraception every day or every time you have sex during this period. Most people on the shot have some change in their periods, including bleeding more days than usual, spotting between periods, or no periods. This is most common during the first year. Other possible side effects include nausea, weight gain, headaches, sore breasts, or depression. One hormone pill is taken each day at about the same time for 21 days. Depending on your pack, you will either stop taking birth control pills for 7 days, as in the 21-day pack, or you will take a pill that contains no hormones for 7 days to 28-day pack. The common side effects of taking contraceptive pill. You may experience irregular vaginal bleeding while taking contraceptive pill. For vaginal ring continuous user, you can also simply leave the vaginal ring inside for 28 to 31 days and then change it without a break. Change your vaginal ring on the 28th day, which is every 4 weeks, or on the same day each calendar month, putting the new one in immediately after you remove the old one. The vaginal ring also have side effect, which is you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. The diaphragm must remain in place for at least 6 hours, such as increased vaginal discharge, not for more than 24 hours. Nausea, it is to reduce the risk and mood changes. Toxic shocks. Diaphragm. The diaphragm must remain in place for at least 6 hours after intercourse, but not for more than 24 hours. It is to reduce the risk of toxic shock syndrome. Most young women who use a diaphragm have no problem with it, but possible side effects include irritation of the vagina and surrounding skin or an allergic reaction, strong odors or vaginal discharge if the diaphragm is left in too long. The condom rule is to use it in 30 minutes. If you're having a long sex session, change condoms after 30 minutes. Tubal ligation and vasectomies are both effective at preventing pregnancy. They're both designed to be permanent, and they protect you from pregnancy for the rest of your life. The negative effects of tubal ligation are You might have pain or cramps in your belly, fatigue, mild vaginal bleeding, dizziness, or a sore throat from the anesthesia. If the surgeon used gas to inflate your abdomen to do the tubal ligation, you may have some bloating. It could cause belly or shoulder pain. This should go away in a couple of days. While vasectomies can have some risks. The most common risk with a vasectomy is infection, but those are usually minor and treatable with antibiotics. You may also have some pain, bleeding, bruising, or swelling after the procedure.
That is all from us. Thank you.